Deputies met with gunfire at a home in northeast Bexar County. Investigators say the man that fired at them ended up killing himself during a standoff. This all started when a family member called deputies asking them to do a wellness check. When deputies arrived, the sheriff says that they came under fire. Tonight, we're still waiting to learn the name of that man. As for the deputies, they were not hurt. And police say those types of situations are becoming way more common. Officers encountering people during a mental health crisis, which can turn into a dangerous situation. Only on KENS 5 tonight, reporter Sue Calber talked with 4 local police chiefs about this very concern.
An armed man wandering a neighborhood, firing shots.
Shirts police!
In the late night hours of February 25th, Shirts police talking him down, getting him to surrender, and the feat was made easier because they had dealt with him before. What the public didn't know at the time is that the man firing indiscriminate shots just before midnight had been handled by police the very same day, about 5 o'clock in the morning. He was brought to this hospital for a voluntary mental health hold to be evaluated. But he was better when he got here, so after a couple of hours, he was released. And they say this is a life-threatening scenario that's becoming more and more common because mental health holds are a complicated process.
But there's only so much we're allowed to do by law and by the situation. We're limited.
After dealing with that, it's left to the hospital system.
We absolutely are part of the solution.
Shirts Chief Jim Lowry says peaceful resolutions require a group effort.
There are other stakeholders that have actually a bigger part in this. So law enforcement has a key role because it does impact society when it's a danger to themselves or others. But once we take somebody into protective custody, it now becomes another stakeholder's responsibility.
Their crisis intervention training is part of that curriculum now.
Chief Johnny Siemens of Universal City says listening matters.
You can be statutorily right, doesn't make it morally or ethically right. We want them being problem solvers and not just call takers, and so a lot of time is invested in these types of calls.
They say if the person doesn't seem to be a danger to themselves or others when they are evaluated, they can be released.
And one thing is it's really important to understand is a person is not a criminal, they're a patient. They're dealing with a medical episode, we understand that.
The chiefs we spoke with said they hope everybody learns more about the process and maybe even becomes involved in the conversation about the challenges we all share. Sue Calber, KENS 5.
This is an important topic that we know impacts so many families. So if you want to know more about how things work, we've got the entire conversations with these chiefs. Download KENS 5 Plus on your TV and watch for free now.